need to look at you.
It's all good. It's all good.
Okay, I'm Eileen Hwang. I'm an assistant professor at the University of Utah in the Department of Ophthalmology. I'm a clinician scientist, so in my clinical work, I treat adult and pediatric retina patients. And in my lab and clinical research, we study the vitreous gel of the eye, which is something that can lead to retinal detachment. So, yeah, I like going camping with my son and my husband. My son also likes to come to conferences at the request of my mom. So he's here, and he was at the College and Gordon conference too. So. Definitely collagen, but I don't know. I guess right now, collagen 9 probably. It's a tie between collagen 2 and collagen 9 as far as important molecules in the vitreous. Although collagen 5 and 11 are also there, we haven't yet dabbled in there yet. I think that our developing ways to image the collagen fibers in the vitreous, which was a major advancement to those of us who care about the vitreous. The vitreous is uniquely difficult to image because it's very high water content. It's like 98% water. It's got 100 times less collagen than the cornea. So everyone that tells me, oh, you could use second harmonic generation to image the vitreous, it doesn't work because the signal is too weak. But we applied what all the materials people, the biomechanical people were doing with collagen gels, which is reflectance microscopy, which does not require sectioning or staining to the vitreous. And we've employed that now to demonstrate that with aging and with Stickler syndrome, at least in mice, we observe an uneven distribution of collagen fibers that we hypothesize could be on the pathway to retinal detachment. So definitely, we are also, using immunofluorescence, and then we're using these imaging methods to develop ways to measure gel stiffness by mechanically perturbing. We call it slamming, although my collaborator asked us not to refer to it as slamming. One of the graduate students coined that term by slamming the eye and watching the drift or the jiggle. Also words that my collaborator has told me not to use. She said, don't call it the jiggle. But anyway, those are, by tracking the drift or the jiggle of the collagen fibers in the vitreous, we can get an idea of relative gel stiffness. So. I forgot what words I'm supposed to use because we just use the jiggle and the slam all the time, so yeah. So definitely my, I guess, a hatred of medical school is really the foundation of that. I started medical school and I realized that it was all about memorization, not about understanding the why of certain diseases. And also in medical school, you understand how many questions that can come up, which people don't know the answers to. So as an escape, I did research between first and second year of medical school. I never wanted to go back, but my lovely mentor had the foresight to encourage me to complete my MD so that I could have a job even if research didn't work out, because it is hard to succeed as a researcher. But if you just complete your MD, you can at least be employed. So, yeah. There's definitely advantages in that, I am really well aware of what are the clinical problems that remain unsolved and how to plug in, the things that we can do in research to those problems. There's, major disadvantages as well, having, a lot of my time dedicated to my patients. So, it's pluses and minuses. So definitely Barbara Brodsky, my PhD mentor, she thought I could become a scientist, and I guess I'm starting to believe her now. But also Dr. Emmy Hartnett, she's also a clinician scientist who mentored me as I was starting my faculty position, and she really taught me a lot about how to channel my million ideas into a hypothesis and how to communicate that hypothesis and test that hypothesis in a fundable way. So she's really been a good mentor that way. So. I guess I would just say to follow your interests. I think don't try to I think a lot of times people have a lot of limitations on themselves, oh, I can't do this, or this is not possible. But I mean, definitely look at how practical things are, but maybe try to get your mind out of those boxes of, you know, what you can or can't do. So. Yeah, definitely the first time I attended the ASMB, you know, I think they have like the major speaker in the session, then like the more minor speakers, but I ended up collaborating with the major speaker in the session, and that really, you know, started me off in our whole, you know, imaging realm. So that was really key. Dogs. And my son feels the same way. You know, anytime he sees a dog, he gets very enthused, but cats, it's kind of like not as much. Collagen. Of course.
Easy.
Yeah. All right, thank you.